For the first time in 12 years, there is an update to the clinical practice guidelines for treating a sleep disorder called Restless Leg Syndrome, or RLS. The condition is common and impacts 2 to 3% of adults in the U.S. To learn more about this chronic sleep disorder and the significance of the change to the clinical practice guidelines, we are joined by Dr. John Winkelman, Chief of Sleep Medicine at Massachusetts General Hospital and the chair of the committee that updated the guidelines. Nice to be speaking with you, Dr. Winkelman.
Thank you for having me.
Great. So I will start with the first question. What is restless leg syndrome and who is affected?
Restless leg syndrome is a neurological disorder that affects sleep. The way that it affects sleep is that people who have it have this strong urge, or you might even say need, to move their legs when they are laying down at night. So as you can imagine, that's very frustrating. People are sleepy, they lay down, they get these uncomfortable feelings in their legs, have to get up and walk around. So they have problems falling asleep and falling back asleep in the middle of the night, and then they're sleep deprived during the day. Women are more commonly affected than men, about twice as commonly, and everybody is more likely to have it as they get older.
Okay, and what is the significance of the recently updated treatment guidelines?
The American Academy of Sleep Medicine has updated the clinical practice guidelines for the first time since 2012, 12 years. And a lot has gone on in sleep medicine during this time and in restless legs research as well. I've been involved in the development of medicines and devices to treat RLS for over 20 years, always trying to find better treatments. And I've been a paid consultant to a number of companies, including Azurity Pharmaceuticals. The big change to these guidelines here in 2024 versus those in 2012 is that our go-to first-line medications for the last 20 years and strongly recommended in 2012, we are now conditionally recommending against. And these are the dopamine agonists, medicines that work at the dopamine system. They work really well over the short term for restless legs, for a few months or maybe even a few years. But unfortunately, over the long term, for many people, these medicines make restless legs worse, involving more hours of the day, not just bedtime or nighttime, and involving not just the legs, but the arms as well. And this is the last thing that any doctor wants, is to have their medicine worsen the symptoms that people came to them trying to seek help for. The good news is that even with this downgrading of these dopamine agonists, we have 4 strongly recommended treatments for restless legs. Those are gabapentin, gabapentin enicarbal, pregabalin, and intravenous iron. They all work for RLS, and gabapentin enicarbal and intravenous iron work for all 3 of the key outcomes that we're interested in, which are RLS severity, sleep, and quality of life. So we've got good treatments for RLS, even though we've downgraded the dopamine agonists.
That's great. And why is it important for patients and physicians to be aware of this change?
Well, patients should know that restless leg syndrome exists, and that if they're having uncomfortable feelings in their legs at night, they can go to their doctor and say, I think I might have restless legs, and I understand there are these new recommendations. Are you aware of them? And that can initiate a conversation. Doctors need to be aware as well, because the medications that they have commonly used over the past 20 years, these dopamine medicines, have now been downgraded to where we're conditionally against their standard use. Of course, all medications can produce side effects. And so you need to discuss possible side effects with your doctor and balance the benefits of the medicine versus any potential short or long-term side effects.
And lastly, where can people find out more about the new guidelines and these treatment options?
Probably the best place is the Restless Leg Syndrome Foundation website. The RLS Foundation is a patient-oriented organization with really great information on their website that is readable for non-physicians and has valuable and credible information there. The website address is rls.org. rls.org, very easy to remember. It's a really nice website and a good resource for people.
Great. Thank you so much for this information and your time today, Dr. Winkleman.
Thank you for having me.
All right. Bye-bye. Thanks.
Bye.